Hello, my name is Antoni Trilla. I'm the head of preventive medicine and epidemiology unit at the Hospital Clínic of Barcelona, and I'm also a full professor of public health at the University of Barcelona. The aim of this talk will be to review the Covid-19 epidemiological features and the basic measures for the prevention and control of this disease. All the world, nearly all the world, is suffering different stages of a pandemic. It starts in China, as you know quite well, and it spreads coming to Europe and then making a jump to the Americas. And at the time being, there are a lot of countries in the world who had either been hit by the number of cases of COVID-19 or are preventing it through different measures like lockdowns or social distancing and so forth. So we are just in the midst of a pandemic that had been very hard to manage in many countries and is going to be also very hard to manage in different countries that are now start suffering it. We know not very many things, but every day we gain a lot of knowledge about how the virus, the SARS-CoV-2 virus, is transmitted. And we know at the time being that the most efficient way of transmitting this disease is by droplet and contact. Imagine that this citizen here traveling in a metro is having COVID-19. He will spread the virus by breathing, talking, speaking, and so forth. Therefore, the control measures will be the respiratory etiquette and frequent hand washing, because he touches also some surfaces that could be contaminated at the time being. So cleaning of the surfaces and hand washing is also very important. We know that under normal circumstances, the virus did not travel very far, probably some sort of 2 meters. So that will be 6 feet, more or less. That will be the safety distance to keep without any kind of protection, to keep to another people at a minimum of 2 meters, 6 foot, it's enough. And also we know that the risk of being infected by the virus has something to do with the time you are exposed to the virus. So we put a cutoff point of 15 minutes as a minimum risk time to be, but it can be extended a little bit, but certainly the time you spend close to another people who had the virus, either symptomatic or asymptomatic, the higher the risk of you being infected if you don't use the protection and prevention measures. Most infectious diseases are transmitted while the patient has symptoms. That will be the transmission in the symptomatic period. But also, there are some infectious disease, certainly, that could be transmitted before the symptoms start. That means in the incubation period. So we believe that in most diseases, there will be the period of communicability that extends all the symptomatic period. In some cases, when this symptomatic period is over, there still could be some sort of transmissibility, but certainly before. In this disease, in COVID-19, the incubation period is on average, from 5 to 7 days. Therefore, we use as a double time that between 10 and 14 days, the time that the patient should be in isolation or quarantine. But one of the main problems in trying to control this disease has been the recognition that before symptoms start, even in patients with no symptoms, the virus can be transmitted. So these are the asymptomatic cases that, starting the epidemic in China, were believed to be very low numbers, between 1% and 3%. But nowadays, we believe that it is a number very much higher, between maybe something like 25 to 50%. It's very difficult to try to stop a disease who is transmitted from asymptomatic cases in such a high proportion, and is easily transmitted by direct contact with breathing, droplets, and things like that. So we face a very difficult disease to stop by the common use means of prevention and control of infectious disease. The strategy at the beginning of the epidemic, and now that many countries has passed the peak of the epidemic and are trying to control the transmission in the community, is to detect, to isolate cases, and to identify contacts. That means breaking the chain of transmission. Each person could infect another one, and therefore another one, and these are contacts, and these are new cases and new contacts, and a lot of people can be infected from a single case. If we are able to detect those cases, isolate them, and identify the contacts, and also quarantine the contacts, we can break the chain of transmission. Maybe we cannot break all the chains of transmission, but certainly it's the only way at the time being to keep the disease under control, to detect, to isolate cases, identify contacts, and break the chain of transmission. How is the situation in Spain at the time being? A couple of weeks ago, Spain starts having the outbreak at the beginning of March. Then the number of cases increased very rapidly. And then with the efforts of the society, with the prevention and control, with a heavy stress on the health system, we can be able to flatten the curve. And nowadays we have a very low number of daily new cases. So these are the common shape of an epidemic that at the highest point has more than 9,000 new cases per day. And nowadays we have less than 300, 200 new cases per day. The clinical characteristic of COVID-19 patients in Spain are to some extent a little bit different, but in other way very similar to other countries. Now we start seeing a slightly increase in females. Now these numbers will be perhaps a little bit lower for males and a little bit higher for females. You have to take into account that the Spanish population is a very old one. We have the highest life expectancy in the world together with Japan. On average, the life expectancy of a Spaniard is 83 years. So there are a lot of people that are very old here in Spain. The mean age of the cases is 60 years. And the most frequent symptoms are, as always, fever, cough, dyspnea, and chills. 30% of the patients develop pneumonia, but also we start seeing different symptoms like in other parts of the world, like gastrointestinal symptoms, diarrhea or vomiting, and certainly a very particular symptom that has been seen in other viral infections, like is the loss of the smell, anosmia or ageusia. The number of cases that need to be admitted in the intensive care unit in Spain has been around 4-5%. And the case fatality rate is here in Spain also very high. At the time being, 8% is the latest figure, although we will talk about that later on. 80% of the cases are mild cases, and those cases has been mostly not diagnosed, so they are not counted at cases at the time being. 15% of the cases has been severe cases that needs admission in the hospital, mostly because of respiratory problems. These are the ones that mostly have been counted, but also in the worst of the epidemic, some cases were not diagnosed by PCR or another diagnostic laboratory test. So we just diagnosed by the clinical and laboratory features. And 5% are very severe cases that need admissions in the ICU, mostly because of complications like RDSS or also thromboembolic complications and certainly cytokine storm complications. We identify here as the most common severity risk factors, the age above 60 years, the presence of cardiovascular disease, and also other chronic disease, mostly diabetes or respiratory disease. As noticed at the beginning of the outbreak, COVID-19, how COVID-19 compares with other disease. In this scale, we have the logarithm of the fatality rate, or the case fatality ratio, so there will be 0.1 fatality ratio, 1% fatality ratio, 10% fatality ratio. And here, the average number of people infected by each sick person. We have here, for example, measles, that is a well-known disease that is highly transmissible, but with a very low fatality rate. On the other hand, another coronavirus like MERS coronavirus, which is not very much transmissible, less than 1, with a fatality rate certainly between 30 and 40%. And COVID-19 at the beginning, now these numbers will be getting closer to what could be the real number, it's more transmissible, for example, than the seasonal flu, and certainly more deathly than the seasonal flu. Probably death case fatality rate will finally end up between something like 1% or 2%, and the average number of infections will be higher than 1, probably close than 2. So we have a highly transmissible and more lethal disease, COVID-19, than the common flu. In Spain, in the gray bars, you have the age distribution of the Spanish population. As you see here, there is a lot of people above 60 years of age. And we have here the men affected by COVID disease, the distribution of the age of the men affected, and distribution of women affected by COVID disease. And that you can see easily that is quite different from the normal age distribution. So younger people is very seldom affected by the disease. Middle-aged people is less affected than is supposed to be according to the age distribution of the general population, and older people are clearly more affected than it's supposed to be according to the age distribution. When we see the clinical course of these patients, we see that in the younger, this is age groups. This is the percent or the number, the average number of cases. In the age group that are younger, there will be less patients admitted, like the blue bar, especially in the ICUs. In the ICU, that's the orange bar, the number of people who is admitted in the younger groups of age is very low. And here, above 60, certainly about 70, and it's increasing. And certainly the number of deaths, that is the brown bar, it's clearly higher in the older group of age. In the other side, people less than 14 years old, so kids and younger people, are neither affected nor hospitalized, and certainly with a very, very low, fortunately, death rate. If we relate the number of cases per million inhabitants, and this has been updated 3 weeks ago, we see here that Spain is one of the more severe affected countries. We rank now number third in the world of the number of cases per million inhabitants. Number 1 is Singapore, number 2 is Ireland, and it's followed by Belgium, the United States, Italy, and so forth. But if we look at the number of deaths by COVID-19, also by million inhabitants, this has been updated 2 weeks ago. Belgium is the number 1 country in the world in the number of deaths per million inhabitants, followed by Spain, the UK, Italy, and France. So Spain as a country has been heavily affected either in the number of cases, but also in the number of deaths per million inhabitants. We don't know exactly how many people die because of COVID-19. So we have to look in a statistical way to what we call the excess mortality. That means we calculate the average number of deaths in a period of time over the last 2 or 3 years and see at the time being how many people has died in excess. That's the red curve here. And we see, for example, in Belgium, the average of expected deaths over the last years will be the gray line, and the number of excess mortality, so the number of people who has died in excess, is like 57% higher. In Spain, down in this corner, we have pretty much the same figures, 49% higher. And there are other countries like the UK that has figures even higher with 60-something on excess mortality. Until the end of the outbreak of the pandemic, we will not know exactly how many people could be attributable the death to the COVID-19, but certainly there is a high excess mortality at the time being, and it's probably due mostly, if not all, to COVID-19. What kind of a strategy decided Spain to do after the extraordinary fast spread of the initial cases with autochthonous transmission in the very heavily populated areas of Spain, that means Madrid and Barcelona? We decided to go, as the WHO recommends, to the mitigation strategy. The initial contention strategy failed because the high number of cases, the speed of the transmission, and certainly because there will be autochthonous transmission that goes undetected, mostly because of the asymptomatic cases. So we decided to try to flatten the curve, to spread the cases over time in order to preserve and take care of the healthcare system, notably the ICU beds. The number of ICU beds in Spain is not very high. We have close to 10 ICU beds per 100,000 inhabitants. And as you can see, the United States has the highest number of ICU beds per 100,000 inhabitants. In Europe, it's Germany, the #1 country with the higher number of beds, nearly 30 ICU beds per 100,000 inhabitants. It's 3 times higher than the ones we have in Spain, and close to 4 times higher the ones that they have in the United Kingdom. And the beds has been the more critical part of the healthcare system in this pandemic. A lot of people, 4% is a very high number of people need admissions to the ICUs. This is an ICU from Wuhan in China that is very heavily crowded with people, and most of them need very, very specialized care. The death of patients in Spain are clearly related to the age of these patients. Here we have the percentage of cases in the blue bars, and here in the vertical axis, and the percentage of deaths in the vertical axis on the brown bars. And this is the age groups. So as you can see, the brown bars are clearly increasing. And if you take into account people aged more than 80 years, it's accounting for a little bit more than 60, close to 70% of the deaths. And if you add up people from 70 to 79, that will be that close to 90%, 80-something% of the people who died has more than 70 years of age here in Spain. And finally, what about the prevention? We have devised many scenarios, but we need a vaccine. We certainly need a vaccine or several vaccines. Now, at the time being, we are pretty much sure that there is some sort of natural immunity. So people who is infected develop antibodies and probably develop also some sort of cell memory, long-term memory. And then we can aim for a vaccine that helps to develop those kind of immunity. At the time being, there are more than 120 candidates to be vaccines. 7 or 8 of them are certainly now moving into phase 1 and phase 2 clinical trials in humans. For stating the safety, that is a very important issue, always talking about vaccines. The vaccine must be safe, and also to try to examine as much as possible the efficacy, so the immunologic response, but because at the time being there is still not very many animal models that could help us in challenge with the virus. So we start looking for the safety of these candidates and to the answer that they elicit in the volunteers that were taking the vaccine, if they develop antibodies, what kind of antibodies, for how long, and if those antibodies are protective or not. You can add also to the difficulties of this kind of a research that a normal development of a vaccine take more than 8, 10, even 12 years. And we are looking now at 2 years period for having one or several vaccines. And then you have to add also the very difficult task of producing hundreds or thousands of millions of doses of the vaccine in order to be deployed to all the world. So we cannot expect this to be a reality, at least my belief is before a couple of years at the earliest. Jumping to the conclusions, we have many questions still to solve. The evolution of the epidemic must be followed on a daily basis. And if we are well informed and we can contribute to counteract rumors and fake news, that's a good thing that all the healthcare workers can do. For the time being, we need to apply all the prevention and isolation measures that we know, very old-fashioned ones, but we don't have anything better. We have to rely very much upon hand hygiene, respiratory etiquette, cleaning of surfaces, and so forth. And we have to rely also on social distancing. If there is a high outbreak with a lot of number of cases, there will be lockdowns and you must stay at home. If not, like here in Spain, we start now moving, going again to the street, moving also, being able to travel, although with some restrictions. So we aim for controlled movements and also try to control the high risk events like very mass gatherings in closed space. that I think that will be the latest thing that we can think about in this pandemic. As Peter Medawar, who wins the Nobel laureate in medicine in the year 1960, said, a virus is always a problem wrapped in protein. This COVID virus is a big problem wrapped in protein. We don't know very many things about the virus. We must rely very much in the biomedical research, in science, and in trustworthy information in order to be able to defeat this virus. Sorry. Thank you very much for your attention. Stay safe and have a nice day.